Imagine having a fever for nearly a year.
Starts out in the 99 range in the morning and escalates throughout the day to the 101 range.
After getting sick with COVID-19 last March, 47-year-old Amy Watson is technically virus-free, but she is still suffering symptoms. She says she coined the phrase long haulers.
On April 29th, I created LongHaul COVID Fighters. I named it after a trucker cap that I wore to my drive-up COVID test.
The name stuck, and the support group she started just keeps growing.
It's taking a long time for the medical community to catch up to where we are, and we are suffering, and we need help.
The NIH wants to change that, launching a $1 billion initiative to study long haulers.
Respiratory viruses, like a cold if it's minor, or the flu if it's not so minor, people tend to get better after a couple of weeks. And with COVID, for a lot of people, that doesn't seem to be happening.
The brain fog just won't go away.
Body aches, tired, can't think straight, my chest hurts.
Feels off, like I'm searching for words.
NIH Director Dr. Francis Collins says there is no pattern to who gets hit with long COVID. Young, old, some really sick with COVID at first, while others weren't sick at all.
We know there are people that have had these lasting effects for months. Do you suspect it could be longer than that, years even?
I fear that some people who have had these effects, who are already 3 or 4 months out, may not be on a path to get better in a few more months, and this could be something that becomes a chronic illness.
While there are still many questions, medical professionals say there are theories about the cause. One is that the immune system clears the virus, but just keeps on fighting as if it's there. NIH neurologist Dr. Avindra Nath showed us what that can do to the brain.
So those little marks right there that are on that slide, they shouldn't be there?
They shouldn't be there. All this green stuff should not be there.
You said earlier they're leaking?
The damage of the blood vessels allows the leakage of this protein into the brain itself.
I'm not a neurologist, but leaking in the brain is not a good thing, right?
Not a good sign, unfortunately.
The brains he is studying are from people who died suddenly from COVID, but didn't have serious symptoms. Dr. Nath says this brain damage may not be severe enough to kill someone, but could be the cause of some of the long hauler symptoms. Amy Watson, who is still unable to return to her teaching job in Portland, will soon be taking part in the NIH study.
I'll be able to access treatment that will help lessen my symptoms and make me feel normal again. I just want to get back to my life.
Long haulers say one of their challenges has been convincing people that what they're going through is linked to COVID. They say that this study, in some ways, before it even really gets off the ground, validates what they've been going through, while at the same time promising to do what it can to help them. Savannah?
Well, is there any sense, Stephanie, of how many people, what percentage of those who've had COVID become long haulers?
Well, it's one of the goals of this study is to try to figure out what that number is. Our medical unit at NBC News canvassed a number of clinics around the country, 64 of them that are just exclusively treating people with these conditions. Of those 64, they say more than 10,000 people have been treated. It's a mix of men and women, and sadly right now, there's no real standard for treatment. Another thing that this study is trying to figure out. Savannah?
Stephanie, I'm glad you're on this subject. Stay on it if you would. Thank you very much. Appreciate it.
Thank you. Quick reminder here, by the way, about vaccinations. Together with our parent company, Comcast NBC Universal, we have an all-in-one tool to help when it's your turn. All you have to do, there it is, right there, right below me, that QR code on your screen. Just scan that, or you can head to planyourvaccine.com. That's where you find all of the information that you need in one place.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.